Labor symptoms during early pregnancy have regular contractions as well as cervix dilations prior to the 37th week of pregnancy. This can be controlled by your healthcare physicians, as well as complications that may be created by the development of the baby. There are causes as well as symptoms which induce labor, which can be enumerated as follows. Abnormal placenta or complications of very severe nature relating to cervix are important, which need attention medically. Infections relating to genital tract which may cause bacteria for weakening, and the resultant rupture which later on leads to a birth during midterm prior to the scheduled time. Chronic illnesses due to maternal problems which are in the form of diabetes prior to the gestation period, anemia of sickle cell, as well as severe asthma etc. also affect the symptoms caused for labor. There are a lot of risk factors which influence your opportunities of getting into various labor practices, which can be controlled by the inclusion of the following methodologies. Use of alcohol, inadequate weight gain, abuse of drugs, smoking, abnormal nutrition can cause a lot of damages, but they can be controlled effectively by varieties of methodologies of self-control, as well as self-restraint. There are some more risk factors which govern these conditions, which can be enlisted: infection, hormonal imbalance, placenta previa, gum infection, under age 17, over age 35, incompetent cervix, structural abnormalities of large fibroids, heavy physical labor, multiple gestations, history of premature deliveries, uterine irritability, abnormality in fetus, chronic maternal illness, high blood pressure, the conditions of heart, liver, kidney disease or diabetes. Labor symptoms are very serious complications during the course of early pregnancy. Many women try to get it early detective, which can help in prevention of premature birth, or for carrying on your pregnancy for the term, or for giving your baby better chances of survival. If you encounter any of these signs or symptoms, you should be sure for contacting your health provider immediately as soon as possible by indication of the following points. Spotting of bright red blood in your abdominal tract. Cramping or more than 5 contractions per hour. Increase of pressure in the abdominal region. Swelling or puffiness face or legs. Problems in the kidney or the tract. Nausea. You should consult a very good gynecologist for an appropriate advice of combating various health conditions for the purposes of getting proper treatments, which should be got done by getting admitted into a very good hospital, getting proper medications, as well as getting proper attention from time to time for enabling very good administration of medical science with the latest technologies involved. There are lots of ways to induce labor practices in the form of the following advised methodologies, which involve a practical application of mind which is engineered by a medical practitioner for showing the signs and symptoms of labor to you and to your partner during your next visit. Swift medical treatment involved with labor can be enlisted as follows. Bed rest medications are used to stop labor, preventing infection or for the development of the lung of baby as a precursor to the birth of the child. Hydration, evaluation of your baby with biophysical profile and various tests. Administrations of drugs for relaxation of the uterus for stopping various pains and contractions. To conclude, these practices can be developed with an idea of prevention of stress and strain, as well as proper care and caution, administered during the birth of the child and prior to that, including the aspects of prenatal as well as postnatal cares.